Hello everyone and welcome back to my YouTube channel. My name is Nurse Zara and today's video is going to be a bit of a heart-to-heart. I'm going to be talking about nursing life on the front line. So a little bit about me before we continue. I'm a surgical nurse by background and I've been doing surgical nursing for over a year. I was redeployed at the end of March in 2020 to intensive care unit to help with the outbreak of coronavirus and care for critically ill patients who were infected with the virus and required essential critical care treatment. It has definitely been a roller coaster and I'm going to share with you all what I've had to experience, also speaking about how it affected my mental health and what my thoughts are now, it being a couple of months later, and how I'm doing. Yeah. So when did I first hear about COVID-19? It was at the start of the year in January 2020. I was at work, I was in a side room with my patient, going about my normal nursing business, and in the side room there is a TV. On the television, there was one of the news channels that were on. They were speaking about China and how this virus has come and is affecting so many of the residents in Wuhan. I remember pausing for a second and listening to what was being said on the news, and my patient said to me, "Nurse, this is a terrible thing that's going on in China. Do you think this will come to the UK?" And very innocently I said, "Yes, this is terrible what's going on, but it will never come to the UK. We're so far away from China. It will never come to the UK." And not long after that, coronavirus hit the UK, and that's when things really got serious. Always think back to that moment, how naive I was, how innocent I was, how hopeful I was. So when did the seriousness hit me and when did it start affecting my practice as a nurse in the UK? So I would say it was at the start of March, and that is when we started receiving cases of suspected and positive cases of COVID-19 patients. I had come into work on the Monday morning. First thing the night nurse said to us before we started the night to day shift handover, "Right team, we have suspected cases of COVID-19 patients in the side rooms in our wards and we have one positive case next door." And my heart sank. And it was strange because the suspected case that was on our ward was in the same side room where I had told my patient at the time that we will not be affected by coronavirus. And I remember just looking at that room thinking, what is to come? What is happening? And that's really when the seriousness hit me. The hospital itself started to change very quickly. There were signs being put up around the hospital explaining to wash your hands and the risks of coronavirus. We were being educated to hold each other to account, to wash your hands, to be careful where you touch. Once you've been in a clinical area, wipe down that space so that there's no cross-contamination. And when you think about it, that should have always been the case, just saying. But there was more of an emphasis because of how rapidly this virus was affecting so many people. So yeah, a lot of changes were happening, and then redeployment happened. Redeployment essentially means when employees in the workplace are transferred to a different area of work. When I heard this term redeployment, I thought I was in the military. And then I was hearing terms like frontline worker, isolation, and I'm thinking, what is going on? This is a hospital. We care for patients. I didn't know what to think of the situation at the time. I was just getting on with it. Now, how did I feel when I was being told I was being redeployed to intensive care unit? Intensive care unit is where the sickest patients in the hospital are being cared for and they require critical care treatment and medical attention. And I don't have a critical care background. I'd never even worked as a student in A&E or intensive care unit. So when I was being told that there is a possibility that you will be transferred, redeployed to intensive care unit, I was very overwhelmed. I was very anxious, and as a nurse I need to step up and deal with this because there are patients out there who need nurses to look after them. So how did my redeployment happen? I was informed overnight that I was going to be redeployed to intensive care unit. So I was told the evening that, okay Zara, you are going to be going to intensive care unit the next day. Report at 7:30 to the intensive care unit matron and make sure you grab your fresh set of scrubs before you do. And that is it. I was redeployed. The only knowledge I had of intensive care unit was it was turned into a COVID intensive care unit. The bed capacity had increased from 8 to over 20 because they had expanded the unit, and all of the patients that you will be looking after are either tested positive for COVID or are highly suspected to have COVID. But I thought to myself, okay, let's do this. I am not alone. There are also other nurses being redeployed and have received similar messages. Let's just deal with this one step at a time. How did you look after your mental health well-being during this time? My mental health well-being has been impacted quite a lot during this time, and I don't think I realized it when I was going through it in the beginning stages, but it's when I reflect back that actually I did go through quite a bit that had put my well-being at a really bad low. I was very emotional. This wasn't a situation that I could make positive. I was seeing very sick patients. My family as well were very concerned about me. I was concerned about myself, and that's okay to say because that's the truth. I was very concerned. I was feeling anxious, overwhelmed. But what's really helped me is being able to speak about my feelings out loud to a person that I trust, and I know I can go to them and be like, I'm struggling with this, or I'm not happy with this, and just vent. Venting is so good. Ranting is sometimes a very good thing. I think also knowing that there were other nurses going through what I was going through helped. I was able to look at the nurse next to me and believe that she knows what I'm going through. How have I had to adapt during COVID-19? Straight up, very quickly. In the beginning stages, there was no time to let my emotions overtake me. I had to get on with it because if I didn't, it's going to affect my work, and there was no way I was going to let that happen. So what were some of the challenges that I faced during my redeployment? The first thing I'm going to say is the PPE. There were episodes where we had shortages of PPE, and of course the PPE in itself, working in the environment that we were working in, it was not easy with all that equipment on to do the care that we needed to carry out. I remember there was this one shift that we had and we had run out of masks. You cannot enter the unit unless you are in full PPE. And I remember standing outside and thinking, I do not have a mask to go and see my patient, and I have so many things that I need to do, and I felt held back. And I remember the queue of nurses who had just come from their break thinking, how are we going to go in? We have to do this for our patient, we have to change this medication, we need to go and speak to the doctor about something, and we were all just there, and we had to get masks from somewhere in the hospital, and that was a very scary situation to be in. How are we going to do our care if we do not have the right equipment? So you can have a look at my previous video where I showed a little demonstration of putting on PPE equipment. I believe the hardest thing that I've had to do as a registered nurse in my career so far is having to tell a family they cannot come into hospital to see their loved one who is going to pass away as a result of COVID-19. The hospital rightfully put in a no visitor rule. This is for the protection of everyone inside the hospital, minimize the risk of spreading the virus. However, what that compromised was giving families closure when their loved one was to pass away. How did I balance fasting during the month of Ramadan with the COVID-19 pandemic? Ramadan is a very important month for Muslims across the world. We dedicate 30 days to abstaining from food and water from when the sun rises in the morning to when the sun sets. So fasting during the pandemic was more of a challenge than it was in previous years, and this was simply because of the PPE equipment that we are now having to wear. Usually I request for night shifts whenever the month of Ramadan happens in the year. But this year, because I was redeployed to a different area, it had meant that my rota had changed accordingly to the ITU rota. But I was able to have some of my long day shifts that were on my rota converted to night shift. That way I could sleep and rest during the day and carry out my prayers as well, and then come on to shift and break my fast. That would also mean that during my shift, my night shift, the PPE, at least I was hydrated before I went back onto the unit. So to me, that was really important. I still had to work long day shifts, and when I worked long day shifts, I did not fast, and I took the decision to do that. And this was also advised by the hospital imam, who really supported staff who wanted to fast but had the challenges of PPE and of course were working in high risk environments. And what's beautiful about Islam is, whilst it is obligatory to fast, if you are unable to fast, you can make it up at a later stage. That is the mindset I took going forward. It wasn't my perfectly planned Ramadan, but I am alhamdulillah grateful that at least I was able to fast, and I had a very understanding unit that wanted to make it work. What have I learnt through this experience about myself? I have learned the importance of resilience and how resilient I can be, and I think that's a good thing. So that's it from me. I really hope that you have enjoyed this video. This is just my own experiences, what I have felt and what I have gone through. So if you enjoyed this video, please give it a thumbs up. That will encourage me to make more videos and content for you guys. If you've got any questions or even want to just say hi, please leave a comment below, and subscribe please to my channel so that you never miss a video with Zara. That's it from me. Stay safe and I'll see you in my next video.